Social anxiety can be very incapacitating for many adults with autism. It can affect them physically and psychologically. At LA Biomed, we spoke to Dr. Charles Grob about strategies for adults with autism coping with their anxiety.
For those who have autism, it can be quite incapacitating. When they're children, when they're adolescents, there's a great deal of support, special programs. They're walked through the education process. But when they hit the world out in their 20s, the supports provided by schools are no longer there. There's certainly the hope that these young people will get out in the world and make their way, establish healthy peer relations, perhaps develop a relationship with a significant other, that they will be able to function out in the workplace. In a sense, they'll be able to be autonomous. Some individuals on the spectrum are quite successful, quite capable of functioning out in the world, but others are immobilized, often by their pervasive anxiety, and tend to retreat, withdraw, and avoid interactions that might catalyze high levels of anxiety. We are currently conducting an FDA-approved study exploring the utility of an MDMA treatment model in adults on the high functioning of the autism spectrum with social anxiety. Subjects are screened into the study. They're provided a series of preparatory psychotherapy sessions. They participate in 2 experimental sessions spaced a month apart. The treatment takes place in one of our outpatient research buildings at LA Biomed. The role of a neurohormone called oxytocin may be implicated here. Oxytocin is a hormone that is present in high levels in nursing mothers. It's considered the bonding hormone, and it's been identified in human subjects in research studies to increase after administration of MDMA, which is the study drug we're using. In our study, which we consider a pilot investigation, to establish that an MDMA treatment model is, number one, feasible, number two, that we are able to establish good safety parameters, and number three, that we might be able to see some indication of therapeutic outcome. Now, if that's the case, it's not definitive proof that we have a viable model, but it would be an indication that we should study this treatment approach further. Over the past 10 years or so, our group here at LA Biomed and Harvard UCLA, as well as other groups around the country, including Johns Hopkins and New York University, have resurrected the hallucinogen treatment model, and we feel there's great potential utility for a variety of conditions. With autism and social anxiety, we felt MDMA, which is 3,4-methylene dioxymethamphetamine, which has properties similar to both hallucinogens and stimulants, would be worthwhile to explore. So what is exciting is, number one, the potential of possibly helping a patient population for whom conventional treatments are lacking, and number two, that we might gain some traction in opening up an entirely new treatment model for psychiatric investigation and potential in the future for a treatment model that individuals with proper certification might be able to employ, if, of course, we continue to establish strong safety parameters and there is some indication of a therapeutic outcome.